A scathing review of how the federal government handled the Mpox outbreak 2 years ago, prompting one New York lawmaker to introduce legislation demanding changes. Our Washington Bureau reporter Kevin Fry has a story.
It's almost as if we've learned nothing.
A damning report from a nonpartisan watchdog evaluating the federal government's response to the 2022 monkeypox outbreak. New York City was the epicenter of that health emergency, which predominantly affected men who have sex with men.
During the peak of the monkeypox pandemic, the LGBTQ community felt abandoned by government at every level, including the federal government.
In a 32-page report, the Government Accountability Office pointed to repeat problems at the Department of Health and Human Services that they've identified during past public health emergencies, including COVID-19. From ineffective communication with the public to hurdles to providing testing and antivirals to obstacles for local governments looking to share their health data. The report saying, in part, HHS does not have a coordinated department-wide approach to identify and resolve past challenges after a response. This has contributed to the recurrence of those challenges during the Mpox emergency and raises concerns for HHS's ability to lead and respond to future emergencies.
The GAO's report was an indictment of the federal government and HHS.
Bronx Congressman Ritchie Torres, who was openly gay, was one of those who called for this review. And he is now introducing legislation mandating HHS establish a department-wide strategy for after-action reviews and improve its communication with at-risk populations.
HHS has been a profound disappointment when it comes to public health, and so it cannot be trusted to implement these recommendations on its own.
In response to the report, HHS says they agree with its recommendations and are working on implementation. In a statement, the department said, quote, HHS takes its role as the designated lead for the federal public health and medical response to public health emergencies seriously and is committed to coordination across the department and with external partners and stakeholders to continue to strengthen future response efforts.